Welcome back to 12 News at 6. It is hard to quantify Arizona's homeless crisis, but it is clear that more needs to be done to help everyone in need.
As the I-Team's Erica Stapleton shows us, lawmakers are trying to tackle all of these issues at the state level, but they're getting stuck. And we do want to give you a warning before you see the story. Some of the images might be very difficult for some viewers.
Every time he leaves the Capitol,
and I saw this young man,
State Representative Matt Gress,
face down with a backpack,
is confronted with a need for change.
We've seen our share of people who are homeless walking around the Capitol, but I've never come across someone who I thought was dead.
This particular time in mid-March, he called 911.
Once the firefighters came and administered Narcan, it became clear to me what had happened.
Phoenix Fire confirms they responded and took a man to the hospital.
That man's clock is ticking. I might not be there the next time he's experiencing an overdose, and he could die.
From losing a job,
that's what makes it the hardest,
to rent rising.
It is very scary. I was on the bus stop bench for a couple of days.
To sky-high health care.
It's a miserable existence.
To agencies failing.
They're not just throwaway people.
To addiction.
The main reason why I use it is because it numbs everything.
There are so many paths leading to homelessness.
That is not a home.
But there's not a clear or easy path out. In the past 2 years I've covered Arizona's homeless crisis, I've seen so many stakeholders trying to help the rising needs. But solutions are not one size fits all, and no one agrees on what to do next.
We really need to reset the conversation when it comes to helping people on the streets.
Last year, lawmakers approved $60 million for a new homeless shelter and services fund under the state's Department of Housing. That's already been divided up into grants for some providers, and lawmakers want to do more.
Do you think the money that's being used for homeless services now is being wasted?
I think that it is doing a certain amount of good. My concern, however, is that a tiny fraction of what's being spent on homelessness is actually going toward treatment.
This session, Representative Gress introduced legislation that, in part, prioritizes treatment, making shelters drug-free zones, with harsher penalties for those who have or are providing drugs inside.
We're not trying to criminalize people who are homeless. We're trying to help them.
He's also calling for an audit on how much the state is spending and requiring providers to report metrics like overdoses and how long someone stays in housing.
We have to see results. We have to know which interventions are working and which are not in order for us as state policymakers and local leaders to do the right thing.
Change is welcome by some.
Left businesses feeling helpless.
It is not about a roof.
Clearly, we're not going to build our way out of this.
But not everyone is on board.
This bill is a train wreck.
This is very dangerous.
It doesn't provide real solutions.
Here's the divide. Some lawmakers are focused on treatment, while others are focused on housing.
We're shooting ourselves in the foot if we just say, oh, let's put them all in jail.
Representative Judy Schwiebert voted down Gress's bill.
Not everybody who is homeless has a substance abuse issue or a mental health issue.
She said she wants to see investment in eviction prevention, affordable housing, and emergency funding.
There's no one silver bullet to solving the homelessness issue.
She also points out that the state's Department of Housing is tracking data, and that asking providers to do more when they're already overwhelmed.
They're going to have to just do double the paperwork and the red tape on that.
The state's housing department does track the $60 million in the new Homeless Services Fund, requiring providers who get the funding to submit progress reports. But that process is just starting out. Plus, not all providers receive state funding. Bottom line, there's not one collective overview that measures what all resources statewide are doing and spending.
There's a systems piece missing, in my opinion.
Amy Schwabenlender is the executive director of Keys to Change, formerly the Human Services Campus, a one-stop shop for homeless services and hundreds of shelter beds that are perpetually full.
How does all of this add up, and where's the investment coming from?
She's one of many providers, including other nonprofits and cities, who voice concerns with Gress's bill.
It takes prevention. Maybe ask us, what could we be doing differently? What would make programs more effective? We haven't really been asked what we need to improve our outcomes.
In her experience,
treatment first isn't evidence-based. It's not considered a best practice.
And what she says they're doing can be misunderstood.
Housing first gets cut off to be housing only, and that's not the definition of it. It is about meeting people where they're at.
And as our reporting shows, people are all over the place. A problem is still a problem, However, it becomes a problem.
The spending time on a debate between treatment first and housing first doesn't accomplish anything. And what we really need to be talking about is how do we prevent more people from losing their homes, falling into homelessness.
Other lawmakers have introduced bills this session that focus on creating more housing and better care for those with serious mental illnesses. And key parts of Gress's bill are now a Senate bill that's still being debated.
I'm asking for your grace today to move this forward so that we can continue.
Prompting promises from lawmakers to work across the aisle.
But what we can't do is continue to kick the can down the road.
Time will tell if they reach a middle ground this session, as more and more people become homeless, whatever the reason may be.
I listened to hours of hearings on this, and you can tell that lawmakers really do want to act on this. But as of now, the bills with Representative Matt Gress's ideas are in limbo. Guys? Yeah, Erica, it's such a sad situation, though. But have any bills that address homelessness or any of the issues related to homelessness gone to the governor's desk this session? So there have been some bills that have been signed into law in recent weeks that some lawmakers are calling wins. There are a few new laws that address needs for those with serious mental illnesses, a group that's vulnerable to homelessness. So more oversight there could help. Governor Hobbs also signed another bill into law recently that makes it easier for empty commercial buildings to be converted into apartments or condos. So perhaps some help there. Yeah. But a lot more needs to be done. Yep, it's a start.
A huge problem.
Yeah, it is. All right, Erica, thank you so much.